There is major controversy surrounding vaccinations in infants and children. Many parents are concerned with the side effects these drugs have on their children, while others argue that the risk of side effects are a better alternative than the life-threatening diseases these vaccines prevent. During this speech, I will explain how vaccinations work, the positive and negative effects of vaccinating, and how vaccinations are created and tested. Vaccinations are essentially an imitation of the infection it is used to prevent. When you administer a vaccine, your body creates antibodies. These antibodies are created by B and T lymphocytes, or white blood cells. With the help of these lymphocytes, your body fights infection. When your body has effectively fought off the imitation infection, you are left with a supply of B and T lymphocytes called memory cells. They are now familiar with the disease and reactivate the moment you encounter this infection again. There are several different types of vaccinations, such as live, inactivated, toxoid, subunit, and conjugate. The type of vaccine depends on the infection, how it infects the cells, and how the immune system responds. Live vaccinations contain a weakened version of the living virus, allowing it to imitate a natural infection. Live vaccinations cannot be administered to children with weakened immune systems. Inactivated vaccinations are made with an inactivated virus and produce a different immune response than live vaccines. These vaccines may need multiple doses to build up their effectiveness. However, all vaccinations may require multiple doses to achieve maximum results. Toxoid vaccinations are used to prevent disease caused by toxin-producing bacteria. Toxoid vaccines train the immune system to fight off these toxins naturally. Subunit vaccinations contain a part of the virus instead of the virus in its entirety. Because it contains only the essential part of the virus, side effects are less common. Conjugate vaccinations fight bacteria called polysaccharides. Polysaccharides have a sugar-like coating that disguises the antigen, which makes them extremely dangerous to children because of their immature immune system. The conjugate vaccine connects the polysaccharides to antigens that an immature immune system will respond to quickly. The effective vaccinations are where the real controversy exists. Many parents wonder if the benefits of vaccinations outweigh the side effects. There are two types of side effects associated with vaccinations: the common reaction and the severe reaction. According to the Center for Disease Control and the American Academy of Pediatrics, the common reaction to vaccinations include low-grade fever, pain at the injection site, and flu-like symptoms. Severe reactions include seizure, severe allergic reactions, and potentially death. There is also the correlation between the MMR vaccination and autism. This is due to a study published in 1998 by The Lancet, which connected the MMR vaccination to the development of autism. However, in 2004, The Lancet retracted the study because the author, Andrew Wakefield, falsified data. There are countless studies, indicating that there is no link between the MMR vaccine and autism. However, this is the most controversial subject, and more than 10% of parents refuse or delay required immunization out of fear. Although the negative side effects of vaccinations can be overwhelming, the positive effects are astounding. Thanks to vaccinations, in 1980, smallpox was declared eradicated. If we continue to vaccinate, the same can happen to many other prevalent diseases. Vaccinations in children currently prevent measles, mumps, polio, tuberculosis, tetanus, whooping cough, and Hib. Diseases which, if not protected against, can cause devastating disabilities. Another positive effect of vaccinating your children is that it's cost effective. It is less expensive to prevent these diseases than it is to treat them. Herd immunization is another positive effect of vaccinating. It is used to protect individuals who are unable to receive vaccination due to compromised immune system. With more parents than ever choosing to forego vaccinations, these individuals are now at a higher risk of contracting diseases. Maybe if we understood the process of how vaccinations are created and tested, more would choose to vaccinate. Vaccinations are created by scientists using parts of a virus. These vaccinations then go through extensive lab testing before they are tested on humans. After years of lab testing, these vaccinations are ready for human trial. Thus begins the Food and Drug Administration's 3-phase trial, which is used to ensure the safety and effectiveness of all vaccines. Phase 1 starts with 20 to 100 healthy adult volunteers. The volunteers are studied to find out if the vaccine is safe and effective. The FDA also looks for side effects and studies how the size of the dose relates to the side effects. Phase 2 involves testing the drug on several hundred volunteers. During this phase, the FDA is paying close attention to the common short-term effects and how the immune system is responding to the vaccine. Phase 3 includes thousands of volunteers who are administered the vaccine. The FDA then monitors how people with the vaccine and without the vaccine compare, as well as the safety, effectiveness, and the side effect of the vaccine. The FDA will then license the vaccine as long as it's safe, effective, and the benefits outweigh the side effects. However, this does not mean that the vaccine will be added to your child's immunization list. The vaccine must be recommended by the Advisory Committee on Immunizations, or the ACIP, which consists of members of the American Academy of Pediatrics and the American Academy of Family Physicians. If the ACIP decided to recommend the vaccine, the CDC director will then have to review the recommendation and either approve or deny the new vaccine. If approved, the vaccine becomes a part of the United States official childhood immunization schedule. However, even after the vaccine has been added to the list, the monitoring continues through the Vaccine Adverse Event Reporting System, or VARS. Anyone can report to VARS, and at any time the recommendations of a vaccine can be changed if the side effects start to outweigh the benefits. There will always be controversy surrounding vaccinations. However, regardless of your stance of vaccinations, it is vital to make informed decisions when it comes to your child's health. Instead of fighting with each other, trying to prove who is right and who is wrong, we should be working together for the greater good of our children's health.